Here we are going to talk about the Guillain Barré syndrome. The Guillain Barré, a disorder of the immune system, where the myelin sheath is attacked by immune cell. So they said a syndrome is an acute infectious neuritis of cranial and peripheral nerve. So in this picture, you can see this is the normal nerve, and the nerve is covered by a myelin sheath. But this myelin sheath is attacked and destroyed and causes the problem. So autoimmune attacked the peripheral nerve myelin sheath. And when this myelin sheath is damaged, patient problem with motor or sensory dysfunction. The immune system overact to the infection and destroy the myelin sheath. Who is affected most? Basically, there's some predisposing events like GI infection, respiratory infection, even vaccination, pregnancy, or any kind of surgery. This is the predisposing factor, act as a trigger. The symptom is usually preceded by a mild upper respiratory infection or gastroenteritis. When patients come to the hospital, they give a history of gastroenteritis, GIT infection or respiratory infection. Recovery is a slow process and can take years. The major concern, Guillain Barré syndrome, is difficult of breathing, and we have to monitor the respiratory status very closely. What next? In this picture, we can see the Guillain Barré we called acute paralytic polyneuropathy. So acute attack of the peripheral nervous system, more than 2 or 3 location or site, so it is called polyneuropathy. Acute means sudden onset, paralytic, and this paralytic is ascending type. So it is start from the lower extremity, from feet, then go up, then to hands and respiratory muscle. And always the symmetrical means if the left leg, right leg also will be attacked. And polyneuropathy means peripheral nervous system attack. When the myelin sheath is destroyed or damaged, or autoimmune attack of peripheral myelin sheath, especially sensory nerves, it is called sensory neuropathy. There are some trigger factor can act, and this is infection. It's usually Campylobacter jejuni or cytomegalo or Epstein-Barr virus. So infection, especially GI infection, is a predisposing events. And what are the presentation of this patient, or what are the symptoms? The most prominent symptom, ascending type of paralysis. What is ascending type of paralysis? So paralysis start from the feet. So in this picture, you can see the paralysis coming up from the feet, and we called the peripheral loss of sensation, symmetrical ascending weakness. If left leg at paralyzed, right leg also is called symmetrical nature, and ascending from feet, then hand, then respiratory muscle. And also neuropathic pain, loss or decrease the reflexes because of peripheral neuropathy. Sometimes the Guillain Barré syndrome attack the cranial nerves, like facial nerve weakness here. When patient got hospitalized, before start the symptom, they gave the history of GI infection 4 weeks ago. After 4 weeks, the primary symptoms start: ascending paralysis from feet, then legs, then thigh, whole extremity, then 2 legs during 2 to 4 weeks. And after a month, patient present with other sign and symptom like dyskinesia. Dyskinesia means inability to move voluntary muscle. Male and female equally attacked, like Alzheimer's disease. Next here, what are the other sign and symptom? Sometimes patient present with paresthesia, pain, or hypersensitivity, such as with the weight of the bed sheet or other items touching the body. So hypersensitivity developed. Weakness of lower extremity, gradually progressive weakness of the upper extremity and facial muscle, possible progression to respiratory failure, and patient die because of respiratory failure. So SARN or LPN, it is the first priority. Monitor the respiratory system. If it is untreated, patient develop cardiac dysrhythmia. So the diagnostic criteria, we have to check the CSF that reveal the elevated protein level, and also abnormal electrocardiogram. So in this picture, we can see this man attacked with the GI. So it is called acute inflammatory demyelinated polyneuropathy. Most cases are give a history of infection such as Campylobacter jejuni or cytomegalo. Here we are showing the paresthesia in the upper extremity and lower extremity, and symmetrical and muscle weakness usually begin legs and then ascending nature. And finally, you see the lungs get involved. So how patient can present? Patient present with gastrointestinal infection, then paralysis 2 legs. It is ascending nature, get involved the hands, and then if it is untreated, so severe respiratory muscle weakness, and also patient die because of difficulty of ventilation. So they need the support. So what are the treatment? How we treat them? So before to go the treatment option, I want to share as a RN or LPN what are the intervention. Let me read it. The care is directed towards the treatment of symptom, including pain management. So symptomatic treatment. If pain, give them analgesic. Monitor respiratory status, provide respiratory treatment, prepare to initiate respiratory support, and monitor cardiac status. Also, monitor for complication or provide the client and family support. So motivation is very important. It also helps to heal up. Now we are going to talk about the diagnosis and treatment. So here they said, basically, the Guillain Barré diagnosed clinically. There are no specific test. And also we should follow the Brighton criteria. And the clinical diagnosis supported by some of the investigation, like nerve conduction studies and reduce the signal, and lumbar puncture. So through the lumbar puncture, we collect the cerebrospinal fluid. In the cerebrospinal fluid, we can see the protein count is increased, raise the protein level, but blood sugar or other findings should be normal. So increase the serum protein in cerebrospinal fluid, the most diagnostic tools to distinguish the Guillain Barré syndrome. And most important, respiratory assessment, the most priorities. What are the management? First of all, the IV immunoglobulins or plasma exchange. So remove the antibody. At the beginning, I told you, Guillain Barré is an autoimmune attack of peripheral nerve system. It is the disorder of immune system where the nerve cell attacked by autoantibodies or by immune cell. So we have to remove the antibodies. We call plasma exchange or plasma pheresis. But if we go for plasma pheresis, keep in mind the side effect hypotension. We also give anticoagulant and supportive care. So why we give them anticoagulant? Because this patient have a chance to develop blood clot. We have to prevent the blood clot by anticoagulant. Otherwise, blood clot lead to the pulmonary embolism, another big problem. And also we give them low molecular weight heparin or intravenous immunoglobulin. So this is more than enough for Guillain Barré syndrome.